My name is Kyle Baltrusch. I am a plastic surgeon at Portland Plastic Surgery Group in Portland, Oregon.
Okay, so you go from diagnosis to oncology, and then oncology very quickly sends you to the plastic surgeon, depending on which path they think you should go down. How often is a mastectomy and reconstruction happening at the same time?
So I do a two-stage reconstruction with my mastectomy patients. And so at the time of the mastectomy, I am putting in tissue expanders. And then sometimes I also perform breast lifts and different variations to establish a more cosmetic breast mound. And then about 4 months later, I do the second stage reconstruction where I take out the tissue expander and put in their permanent implant. So the second stage reconstruction, I don't do at the hospital, I do at our surgery centers. So it's another whole team of doctors. So we work with the same nurses and anesthesiologists at those surgery centers as well. So there's the hospital-based team, the office-based team, and the surgery center team.
Can you give us some more detail about the tissue expander process and what that looks like and feels like? And they're called expanders for a reason. Are they getting bigger over that 4 months or however long that is?
Yeah, so part of the consultation with the patient is to establish their goals. If they are moving forward with mastectomies, then the discussion is, are you having a unilateral, meaning one-sided, or bilateral, both-sided mastectomies? And so if a unilateral procedure is performed, then obviously the non-cancerous breast acts as a template for reconstruction of volume. If they're having bilateral, then the discussion is, what size do you want to be? I certainly have patients who want to have smaller breasts after reconstruction, and I have patients that want to increase their breast size after reconstruction. So you have to establish a patient's goals so you know which tissue expanders to be putting in at the time of mastectomy. And so a tissue expander is just a temporary silicone shelled saline implant, a little bit firm, but it's anatomic in form. So it sits in the chest cavity in a certain position. It's sutured to the fascia, so it holds it in position. And then, after mastectomy, there's a very significant decrease in sensation of the chest wall. And so it makes it very easy for us in clinic to locate the port of that tissue expander and just kind of pop a needle into it through the patient's skin. And then we slowly expand the breast back out to size or out to goal. And that's done starting at 3 weeks after surgery. And we meet patients every week or so until they're at their goal size.
Do you have any idea what that feels like to have the tissue expander in and constantly expanding your tissue?
I personally don't, but patients, tell me that the tissue expanders are uncomfortable. They can kind of feel the edges of them. They can even cause, muscle spasm of the pec muscle. And so they're not the most comfortable. And I just remind patients that they are a temporary device. Most patients are very excited to get the tissue expander out and get the permanent implant in place.
I know the purpose is in the name of the device. What is the purpose of the tissue expander? What are you trying to achieve?
Yeah, it's a placeholder. So, if you did a mastectomy and you didn't do any sort of reconstruction, those tissues would scar down. And so the tissue expander is a placeholder. It's keeping the domain of the breast. It allows us to maintain shape and better cosmesis overall. And so it expands preferentially the lower pole of the breast for a more anatomic slope. I do all my reconstruction on top of the muscle. And so basically just replaces where the glandular tissue was.
So they're coming in about every week is usually about 4 months before they're ready.
It's roughly every 2 weeks. If I need to get a patient expanded quicker because of radiation, I do like the tissue expander to be at full volume before the patient gets radiated. And so the radiation oncologists do want to get patients in before 3 months. So starting at 3 weeks, I do start the expansion process. And then it kind of just depends on, future management. It may only be a few expansions before then the patient just gets a big break from me and I see them at their preoperative appointment for their second stage reconstruction. But yeah, it's every few weeks until we're expanded.
Do they come to your office or are they seeing you at the hospital?
The expansions are done here in our office. My PA as well as my nurse also perform expansions. Sadly, we have a lot of women coming in with tissue expanders. And so we need multiple people in our office to be able to perform those.
So do you get to be friends with all of these patients as they're kind of coming and going?
Yeah, I really enjoy catching up with all of my patients on such a frequent basis. And what I love about cancer reconstruction is, you're really helping someone through a very difficult time in their life. And they become lifelong patients of mine. So once I have an implant in a patient, that's a yearly follow-up until we discuss exchanging that implant in roughly 12 years or so.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at Where Before Meets After. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. THEAXIS.io.